The Sexual Assault Kit Initiative is important to Michigan.
This initiative is very important to the Kansas Bureau of Investigation.
The Sacking Initiative is important to the state of Nevada.
This initiative is important for the Iowa Department of Justice.
This initiative is important to the West Virginia Division of Justice and Community Services.
States face special challenges, and that's for a number of reasons. It's more difficult to get broad consensus at a state level. And then, of course, building consensus, doing victim notification, doing training across all these agencies. It's just a tougher job for states.
Kansas is home to 3 million citizens, 105 different counties, and nearly 400 law enforcement agencies. So interacting with all of those different counties and law enforcement agencies has presented a unique challenge.
Nevada is the 7th largest state in the country. And yet our population is very small and condensed into small areas. So one of the challenges is that we have many people in rural areas that don't have access to the sexual assault nurse examiners, and we don't have organized sexual assault response teams. So that is a big challenge for us.
The current challenges under the SACI grant, of course, is getting the inventory completed. We have 16 counties under our grant, but there's 55 counties in the state. But you have city police departments, you have sheriffs, and then you have state police.
We have 600 law enforcement agencies spread out over 83 counties. We have 53 medical examiners covering those 83 counties. And we have myriad healthcare facilities that are known to collect sexual assault kits. It's a challenge to reach everybody geographically. It's a challenge because a lot of agencies don't understand why we want to go back and test these kits, some of which are associated with cases that have already been adjudicated.
There seemed to be maybe some reluctance on the part of law enforcement in feeling like they were being questioned about some of the practices that have been in place for decades. This is not an evaluation of any individual agency's practices or a place for anybody to point fingers at one another, but really a way for us to come together and have that courageous conversation.
Some of these agencies are very small, and it can be a lot to ask of them to go back and look through their evidence to tell us what kits they have that have been unsubmitted.
The best way to meet these challenges is try to meet the agencies where they're at, to understand their concerns, to listen to their concerns, and to help them understand what some of the evidence is showing when we test these kits.
Well, we developed a really strong multidisciplinary team. We brought all the right people to the table and did that early. In addition, as we run into challenges, as we move forward, we continue to expand.
Trying to accomplish this on a statewide level, it's a cultural shift, and in order to shift that culture, it requires strong leadership, but it also requires education through training. It's going to be really important that whatever recommendations we offer at the end of this take into consideration that those will be affecting departments of 2 men to departments of 2,000 sworn officers.
It is both a local and a statewide project. And we certainly really enjoy working with our local sites, but the statewide sites, being able to tackle such a challenging topic across an entire state, they're taking on a huge challenge, but it's also an opportunity to have a larger scale of reform and to make a change across an entire state.